Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to everyone. Welcome to Breakfast at Health 2021, episode 22, Wednesday, 9 June 2021. Today we have two presenters that are going to give you a talk with their own expertise. First session will be given by Dr. Choong from Sport Medicine. So let me introduce him. All right, Dr. Choong, Alston Choong, Kwong, graduated from medical degree Universiti Kebangsaan Malaysia, and he's also graduated Sport Medicine and joined Sport Medicine unit for the past 4 years. He has experience in coverage experience at local, national, and also international sporting events. His current research interests, which involve two grants, physical activity, PA at home, special COVID-19 related grant, and also built environment and active living, Be Active, IIRG grant. So looking at his interest in physical activity, for today's session, he will talk about physical activity during pandemic COVID-19. So without any further ado, before that, if you have any question, please write your question at the Q&A box. And if you have time, we will answer the question. If not, during the second session, maybe Dr. Choong will answer the question through the Q&A box. So without further ado, I would like to invite Dr. Choong to proceed with his talk. Please, Dr. Alston Choong.
Okay, a very good morning to all the audience. Thank you so much, Prof. Halim, for the very delightful introductions. I would like to thank also the Faculty of Medicine, the organizer for this breakfast at UMHealth, for giving me opportunity to talk about the importance of physical activity amidst COVID-19. A very brief introduction about myself. I'm currently a sport and exercise medicine physician in UMMC. I'm also the medical lecturer under the Faculty of Medicine's Sport Medicine units. So my content for these episodes of Breakfast at UMHealth will cover just a very brief description about our current situations of COVID-19 pandemic, and then the effect of COVID-19 on physical activity. What are the 4 benefits of physical activity in controlling the COVID-19 pandemic? The implications of the physical inactivity during the pandemic, and some recommendations on the physical activity at home and also physical activity outdoor. And also, I would like to share some of the preliminary findings about my PA at home study. And last but not least, 5 tips for exercise at home. So as we know, the current COVID-19 pandemic, the ongoing COVID-19 pandemic outbreak, which caused by the SARS-CoV-2 virus, was declared as a public health emergency of international concerns by WHO on 30th January 2020, and then declared as global pandemic in March 2020. So according to the data from the WHO as of 8 January, yesterday, 2021, globally, the total number of confirmed cases was about 173 million, with the total new case yesterday reported 266,000, and the number of deaths until yesterday was 3.7 million, which is quite a sad number. However, in Malaysia, the number of new cases was slightly dropped to 5,566 cases, with yesterday that reported 76 cases. Okay, so the lockdown, as you can see, many countries around the world, including Malaysia, has taken urgent, important public health countermeasure to prevent the spreads of the disease, including movement control and lockdown of the general public. Example, the closure of the facilities in the recreation park, restrictions of air travels, and also closure of gym, stadium probably only is not open to the public, and also closure of many tourist attractions and isolations and quarantines of the infected persons. While containment and of the outbreaks is the current public health priority, stringent movement restriction or staying at home does not mean that physical activity must be limited, that or all form of exercise must be eliminated entirely. So before I go into the recommendation of physical activity, some of the important terminology that I would like to share. According to the ACSM guidelines, physical activity simply means any bodily movement produced by the contractions of skeletal muscle that require energy expenditure. Exercise, which is a subform or a subtype under the umbrella terms of physical activity, consisting of a planned structure and repetitive bodily movement to improve or maintain physical fitness. Whereas physical fitness means the ability to carry out daily tasks with vigor and alertness without undue fatigue and with ample energy to enjoy leisure time pursuits and meet unforeseen emergency. So physical fitness is composed of various elements that can further group into either health-related component or skill-related component. The health-related component consists of the cardiorespiratory endurance or aerobic fitness, body composition, muscular strength, muscular endurance, and the skill-related components consist of agility, coordination, balance, power, reaction time, and also speed. Now we move to the effect of how does COVID-19 it have an effect on the physical activity. As we know, the total lockdown or the movement restrictions prolong the home stay, and this actually may reduce the physical activity level and increase the risk of sedentary lifestyle, such as increased sitting and screening time. And then slowly, people might develop unhealthy eating habits, and the physical inactivity itself may worsen the chronic diseases and also increase the cardiovascular risk factor. And this may also lead to increased morbidity and mortality related to COVID-19. There's these articles that I would like to share, which is recently published from the BMJ Open Sport and Exercise Medicine journals, with the title Changes in Physical Activity and Sedentary Behavior from Before to During the COVID-19 Pandemic Lockdown. This systematic review show that majority of the studies show that the physical activity level decreased and the sedentary behavior increased during the COVID-19 lockdown across all reviewed population, except for those with eating disorder patients. Okay. Another study that I would like to share is also from BJSM, okay, British Journal of Sport Medicine. Is a tier 1 peer-reviewed journals. Physical inactivities is associated with higher risk of severe COVID-19 outcome. And this study showed that the patient with COVID-19 who were consistently inactive had a greater risk of hospitalizations, admissions to ICU, and death due to COVID-19 than patients who were consistently meeting physical activity requirement or doing some form of physical activities. Okay, so it's important to if it's possible, to meet the physical activity requirement, or at least to do some form of exercise, so that this will actually reduce the risk of hospitalization, admission to ICU, and also death due to COVID-19. Okay, now I would like to share with you what are the 4 important benefits of physical activity in controlling the COVID-19 pandemics. So as we know, regular physical activity remains an important way of staying healthy despite home stay. Compared to being sedentary, moderate intensity of physical activities is associated with better immune system functions. Moderate physical activity can improve the immune function response to fight against viral respiratory infections through increase in the immune cells such as neutrophils and also natural killer cells, and also reduce the excessive inflammations via the changes in Th1 and Th2 cell response, and this will reduce the severity of infections. Secondly, moderate physical activity can also improve cardiovascular and respiratory functions and improve common chronic diseases, example, cardiovascular disease, diabetes, and hypertension and cancer, and subsequently reduce the risk of severe morbidity and mortality related to COVID-19. Moderate physical activity is one of the best stress management, I would say, to prevent symptoms of anxiety and depressions due to COVID-19 pandemic, and is as effective as medicines and also psychotherapy in some of the literature for the treatment of anxiety and depressions. And last but not least, moderate physical activity help to restore the body cortisol to balanced level. As we know, stress and distress, such as happened during the COVID-19 pandemic, create an imbalance in cortisol level, and this negatively influence immune function and inflammations. Here is another articles that I want to share, published by Pierre et al., the effect of age, gender, income, work, and physical activity on mental health during COVID-19 lockdown in Australia. The article showed that the depression symptoms, which is 21%, and anxiety symptoms, 19%, are higher during the COVID-19 compared to previous epidemiological data, and 16% rated over the cutoff for moderate or severe clinical insomnia. And younger adults, which is less than 35 years, people without work, which is people without work, which is unemployed, and low income group is those group that affected the most during this COVID-19 pandemic. Another articles that I would like to share is it's a systematic review. Is physical activity associated with less depression and anxiety during COVID-19 pandemic? This systematic review show that the COVID-19 pandemic increased system of anxiety and depression symptoms, and those reporting a higher total time spent in moderate to vigorous physical activity had 12 to 32% lower chance of presenting with depressive symptoms, and also 15 to 34% of lower chance of presenting anxiety symptoms. The systematic review also recommend the promotion of physical activity should include a cost-effective and comprehensive worldwide applicable strategy to overcome the severe gaps in between people in need and people receiving mental health care, especially in those low-income countries with even non-existing mental health service. And the second recommendation is web-based technology might be promising tools to increase motivations and volitions for physical activity. However, more systematic research is needed to explore and to develop this physical activity promoting apps or web-based program. Okay, Now, I would like to share with you this risk of URTI versus the exercise load. Okay, so as you can see here, there is actually two curves. One is J curve, another is S curve. Let me elaborate further regarding this curve. Numerous evidence from several large-scale longitudinal studies show that the relationship between exercise intensity, okay, and also all the exercise volume and susceptible to URTI is J curve. This means practicing some regular moderate intensity of physical activity decrease the relative risk of URTI infections by about 40 to 50% below that of a sedentary individual. And the postulated explanations behind is moderate physical activity can improve the immune functions by chronic reductions of pro-inflammatory cytokines, increase resistance to stress stimuli, and thus reduce the risk of infection, respiratory complications, and mortality. However, performing prolonged high-intensity exercise or period of vigorous exercise training is associated with above average risk of infection in moderately trained or sub-elite athletes population. This is due to the dysregulations of cortisol and also glutamine, increased oxidative stress and pro-inflammatory cytokines, and thus increase the susceptibility to infections and immune-related disease. Okay, another graph we show on your right side is the S-shaped curve. This S-shaped model is slightly different with the J-shaped models. The S-shaped models postulated that the relationship between exercise training load and risk of URTI that proposed is in highly trained elite athletes suffer fewer infections than their highly trained counterparts. I mean, the S-shaped curve is actually meant for the highly trained elite athletes. This S-shaped curve suggests that the ability to withstand infection during period of the heightened physiological and psychological strain could actually be the prerequisites for these athletes to achieve the highest performance. Okay, so what are the implications of physical activities during the pandemics? Physical inactivity during COVID-19. First one is actually affect the health and social care. The second one, mental and well-being. And the third one, muscular, skeletal, and deconditioning. Okay, we'll look into one by one. The predictor model on the implications of the physical inactivity during COVID-19 on the health and social care. Generally, the impact can be divided into 4 waves. The first wave is the populations of people who experience COVID-19. These populations of people who experience COVID-19 and recover from the illness will still have ongoing needs. They would have had an enforced period of physical inactivities due to the illness itself, and these people will have specific rehabilitation needs. And currently, this is the obvious population of people that receive focus and attention. The second wave is the people with urgent non-COVID-19 conditions. Although we are dealing with a pandemic at this moment, people all over the world still need healthcare for their existing mental and physical health conditions, especially during period of lockdown. These populations will have ongoing needs in terms of self-management of their condition. In a scenario where healthcare service is under stress, like in our country, the resources are very limited. It is critical to support people in self-management of their condition. So physical activity is one of the important way of supporting these second wave populations to self-manage their condition themselves so that they are able to cope effectively with symptoms such as chronic pain, stiffness, fatigue, and etc. And we can support people to stay active so that they are healthy enough to self-manage their condition during this time. The third wave is actually the impact or interrupted care on chronic conditions, as you can see here. And during the period of lockdown as well, routine healthcare service has been put on hold or paused in many countries around the world. Service such as routine screening, diagnostic, and also elective surgery has been put on hold. This will have an impact of the third wave populations, and these populations are people who have thought that they will have been progressed in terms of diagnosis and management of their condition. Even after the healthcare service resume for this population, it may actually take some time, probably a few months or even years, for the service to clear out the backlog caused by the period of lockdown. And this may have a far-reaching effect, and we should also advocate physical activity and self-manage of their own condition. And then the last phase, the fourth phase, is the people that actually suffer from psychological problem, mental illness, or economic or financial burdens, or even burnouts because of the pandemics. So mental well-being, on the second implications, physical activity actually play a very key and critical role to manage mental health well-being. Study has shown that the enforced sedentary behavior has led to depressive symptoms and low mood in healthy people within 7 days. The third implication, which is the musculoskeletal deconditioning. With decreased physical activity, there is likelihood of musculoskeletal deconditioning, and more pronounced, especially in older people or people diagnosed with health condition or already functioning very close to the functional threshold. And this may lead to the potentially increase the risk of injury related to fall, impact on health, and also social care service that already under stress. Okay, before we start any form of exercise, there is this questionnaire which is called the pre-exercise screening questionnaire. It's just a simple questionnaire to screen for COVID-19 related symptoms before we start on any exercise. So next one, I'd like to share the WHO 2020 guideline on physical activities. Okay, so what are the new things that this guideline introduced? The first one is every step count. In the previous guideline from 2020, only activity that lasts for at least 10 minutes will consider meaningful contribution to physical activity level. The new guidelines clearly state that every single step counts. Physical activity of any duration is associated with adults, is associated with improved health. The second new key introduction is some is better than none and more might be better. For people who are not currently meeting the physical activity guidelines, any physical activity, even at level below the recommended guidelines, will promote health. People meeting and going above the current guideline are likely to gain extra health benefits, but the benefits may be smaller when compared to people with low physical activity level. That is, people who are least active will have the most to gain from increasing their physical activity. The third new recommendation is the physical activity is beneficial for everybody. Tailoring physical activity guidelines to pregnant and postpartum women, individuals with chronic diseases and disability, and also distinguishing between adults and older adults address important gaps in previous health recommendation. And the current health recommendations are confirmed that the daily physical activity for all populations group is feasible and also important for health. And the fourth important new recommendation is minimize sedentary time as much as possible. Okay, and for adults or older adults, including people living with chronic conditions and disability, the recommendations would be for a substantial health benefits, adults should engage in 150 to 300 of moderate intensity of aerobic physical activity. Example, you can do brisk walking, dancing, or 75 minutes to 150 minutes of vigorous activity. Example, running throughout the week, or equivalent combinations of both. Example of aerobic activity like what I have mentioned, brisk walking, dancing, playing sport such as badminton, cycling, swimming, or running. In addition to aerobic physical activity, adults should also do muscle strengthening activity that involve large muscle group of at least 2 days per week. Such activity may involve lifting the weight or doing own body weight exercise, example, push-up, chin-up, sit-up, and can be done at home or in a gym if it's permitted, or in the community, such as in the park. Older adults, defined as those aged 65 years and above, are also encouraged to engage in multi-component activity. So this concept of multi-components activity include dancing, which improves the aerobic capacity and balance, or standing on one foot while doing a bicep curl to concurrently improve the balance and the upper body strength. Adults should also limit the sedentary time and try to replace with movement of any intensity, include slow walk and moving around. For children and also adolescents aged 6 to 17 years old, they should actually do at least average 60 minutes per day of moderate to vigorous intensity, mostly aerobic physical activity across the week. And vigorous intensity aerobic activity, example running, as well as activity that strengthen muscle and bone like jumping, lifting weight, should be incorporated at least 3 days in a week. And children and adolescents should also limit the amount of time spent being sedentary, particularly the amount of recreation screen time, example like social media or video gaming. Okay, so physical activity at home is easily carried out and will help to maintain physical fitness level. Performing household tasks, example like cleaning, gardening, can contribute significantly to the total energy expenditure, especially for the elderly. Okay, this is one of the initiatives that introduced by FIFA together with United Nations and WHO, in which this Be Active and also Healthy at Home campaign was launched in early April 2020, and they actually recommend people to do online exercise class, jumping rope, dancing, muscle strengthening and balance exercise, and playing active video games at home. Okay, I will skip the video because of time's constraint. Okay, next I would like to move to physical activity outdoors. Different countries have different restrictions, rules, and guidelines on, and also SOP. If you want to do physical activity outdoor, try to do in isolation if it's possible, and avoid crowd or large gathering. Practice physical distancing at least 1 meter apart, and also avoid unnecessary touching, and also always maintain an adequate hand hygiene. There's always this question regarding, can people wear masks while exercise? According to the WHO recommendations, people should not wear masks when exercise, as masks may reduce the ability to breathe comfortably. Sweat can make the mask become wet more quickly, which make it difficult to breathe and promote the growth of microorganisms. So the important preventive measure is still the physical distancing and also the proper hand hygiene. So there's this aerodynamic study that conducted by by Blocken et al. The Dutch Belgian study actually advised this study is actually being done in a lab, and they advise to keep a distance of at least 4 to 5 meters behind the leading persons while walking. If you are running, to keep at least 10 meter, and if you are doing fast cycling, at least 20 meter. Okay, and next I would like to share just a very quick preliminary result of the study that I have done using the special COVID-19 special related grant, which is the PA at home study. So we found that during the MCO 1.0, the overall physical activity level and sedentary level is significant. The overall physical activity level is significantly reduced for all the populations, and the sedentary level is significantly increased. And other significant findings include the sitting time for different age group. We found that for younger age group, which is 18 to 29, there is significantly higher increase in sitting time compared to other age group. And then for different marital status, we also found that there is significantly increase in significantly reduced in the physical activity level for singles compared to married and widow, and also significantly increase in the sitting time in a single person, which is single compared to married and widow. And the last finding is a sitting time for different occupation. We also realized that students tend to sit longer compared to other occupations. Okay, and there is a correlation between the changes of physical activity level with motivations, and also correlation between changes of sitting time with the physical activity knowledge. Okay, skip that. So last, I would like to share 5 important tips of exercise at home. First is the body weight exercise. So the body weight exercise like the jumping jack, the squat, the seated extension, leg exercise, and also climbing stair, skipping rope, planks, and also the burpees. All these exercise actually doesn't require any, only require body weight, and some or require very minimal or no equipment at all, and can train a lot of different muscle group in a limited space with a lot of varieties to modify those exercise. The second home exercise tips is to exercise with a partner virtually. So maybe previously you worked out with a fitness buddy or a group of people in the past, but now with because of the social distancing, you are unable to work out together. However, you can use some of the online meeting platform, example like Zoom, the FaceTime, Skype, and also Google Meets to actually keep the social interactions going, even though you are not right to each other. And also this is important to encourage each other during exercise, and also help to monitor the technique that performed during exercise. The help tips number 3 is to have an online fitness class or personal trainer. So most of the gym, I would say all the gyms has closed down because of the lockdown. And some of the big fitness company, they release these streaming fitness classes online, example like Lashmill on demand, Zumba on demand, that you can follow, and you can work out at home at your own leisure time. And a lot of these online fitness class are actually free, or they have offer a free trial for a period of time. So you should actually take advantage and try them out. And also don't forget to check with your local gym or fitness center. Some of them even offering the virtual personal trainer or streaming different fitness classes online to keep their clientele. The fourth health fitness tips is the alternative exercise equipment. As you can see, maybe you don't have equipment in your house, but you still want to keep a really good exercise regimes. So one of the good idea is actually to use or to modify some of the existing thing that you had in your home and make it into weight. Example is like making a sandbag, doing planks with carry a bag with some bolts, using resistant band. Okay, if you like outdoor cycle, you can even modify the outdoor cycle into a stationary bike and exercise at home. The last one is actually by using the TRX suspension system that can use your body weight as the leverage to create a resistance for total body workout. And the last tips is by engaging in some fitness apps. Okay, so as you can see, you can try to find few fitness different apps that you feel comfortable and tailor towards your goal, and this will actually help to keep the fitness level going. So this will bridge the gaps until you can return to your normal routine fitness level. Okay. So the summary of my presentation will be first one, maintain regular physical activity is important to maintain physical and mental health, progressive loading and conditioning in exercise trainings to reduce the risk of getting injury, and always remember to follow and adhere to the SOP and guideline, especially when you are doing physical activities in the gym and also outdoors. Okay, these are some of the useful resources. Okay, my reference, and thank you so much. Sorry for taking extra 10 minutes, and if you have any questions, please feel free to ask. Thank you.
Okay, thank you very much, Dr. Alston Choong. Thank you for the very interesting talk. It is actually very important at this current situation. We need to keep ourselves fit and healthy. What Dr. Choong has mentioned, uh, every step count. So there's no so-called reason why we can't do any form of increasing physical of activity. So there are a variety form of exercise or physical activity that you can do at anywhere or even at your own working space. So with limited space, you still can perform your exercise. So in view of we have second speaker, so all the questions that already in Q&A box, so perhaps Dr. Choong can answer that directly through the Q&A box. So I would like to pass over to our second speaker. Maybe Dr. Wong, would you like to take over for the next session? Thank you very much.